Good afternoon, Dr. Rotter. How are you?
Hi, Shankar. I'm doing great. How are you?
I'm doing great as well. It is April 26th, and we have another episode of Your Awesome Life where you help us understand a little bit about how you can or how people out there can get access to more affordable, high quality healthcare.
Right. I do have a passion for what we talk about. And earlier today, I was talking to another doctor who has a passion about um, getting healthcare out into the rural areas. And so it's fun to talk with other docs that have a passion as well. This doc, I'll be doing a podcast with him in the near future, so we'll keep you guys in tune for when that's coming up.
Oh, that is exciting. So you're doing lives, you're going on podcasts, and that is exactly what I personally think physicians should do a lot more, but it's not easy. Uh,
Well, I'm just going to be honest with you, Shankar. I
yeah.
appreciate your help so much because what a lot of docs are my colleagues. They're my colleagues, and I appreciate them professionally and taking care of patients is it takes a lot of dedication, a lot of training, um, but they don't do it. They don't. Mm, they're they don't have to educate people like I do about direct primary care because that's not what they're in. They're in the traditional model, and
Mhm.
there's no room for that in that model. But I feel very strongly about the direct primary care approach, the direct care approach, that I do spend extra time and money to go out of my way to educate people about it.
Mhm.
And I do that so openly and freely because it's a really good feeling to get those people to come back to you and say thank you for what you did, and thank you for seeing us this way, and thank you for what you have going, because these many times are people that would have gone without.
Yeah.
So that's why, I mean, if people are might be wondering why is this doc on LinkedIn all the time, when is he seeing patients? Well, I've got some great help doing that. I do still see patients, but it's just I get passionate about it. So that's why we do this a lot.
Well, and that's what we all want as patients. We want doctors who are passionate about helping us. And I want to go back to something you said that there is no room for it. There is no room in the traditional model to do things that might be very helpful for the patients. And, it's kind of a good segue into our topic today because something that fills up that room is, of course, health insurance and its complexities. And
Mm.
today we're going to talk about something called the medical loss ratio, which, to be quite frank with you, for the longest time, and I believe I'm not alone there, I had no idea that it existed, let alone what it means. So I'm going to let
Mm.
you explain that to our viewers by bringing up a definition of it.
Yes. So medical loss ratio is part of it's written into the Affordable Care Act, otherwise known as Obamacare, and it basically says that an insurance carrier has to pay at least 80% of the premiums that they collect back to the doctors or hospitals for health care. So on
So you
the
would think that's a good thing, right?
right, you would think that.
Yeah.
But now I would say it's a two-edged sword because as you and I both know, being co-founders of the San Antonio chapter of the Free Market Medical Association, where there is no medical loss ratio, that um, healthcare health insurance is very expensive. Okay, so let's take a look at how this medical loss ratio could potentially increase the cost of health insurance or health care. Okay, so if you're an insurance carrier and the government tells you you have to pay back 80% of all the money you collect, then you're thinking, well, I'm a business, and I've got to survive as a business, and I need to let my shareholders know that we're making money, and I've got to pay them. So how do I make money if the government's telling me I got to pay back this 80%? Well, then what I get to keep is the 20%. So if I get to keep 20% of everything I collect, well, I need to collect more, or I benefit as an insurance company when there's more healthcare spending,
Yeah.
right? So that's the double-edged sword. Um, so take it for what it's worth.
Yeah.
We all need insurance. It's a good thing, but let's let's try to take care of our health directly if we can, and use insurance for more like what it's designed, like for the big stuff.
Mm-hmm. Well, it is really interesting because what that also means by deduction is that really a health insurance company doesn't really have motivation if cost is low because they make less money. And it's just a very interesting insight to have. And now, of course, understanding this also gives a lot of power to help more and help drive down the cost. And that is something you specialize in.
Right. And that's what we're going to be talking about on May 3rd at 10:30 on our LinkedIn live webinar. I hope everybody will tune into that. So I'm going to talk about I'm going to talk about 3 ways that I helped a company save close to $1 million. So if you're an employer, or if you're a healthcare consumer and interested in saving money on health care, real health care, that's access to a doctor, I hope you'll register for this and listen in.
Yeah. And I will tell our viewers the link is link.directmedclinic.com/employers. It is blended in here as a ticker at the bottom. So definitely make sure to go to link.directmedclinic.com/employers. And then we can all be educated by Dr. Mochigemba on May 3rd.
Very good.
Okay. Well, this was a great session. Thank you again for being available on behalf of really anyone out there who needs to learn and hear this. And we will be back because you, Dr. Rodra, you have gotten a liking for lives and for going on podcasts. So definitely a man, a physician who is willing to be an influence in this space. And I think it's safe to say if more people want you as a guest on their podcast, or maybe even as a feature speaker to speak to the points that we addressed today, they are welcome to find you on LinkedIn and connect with you and then organize something like that.
Yeah.
Okay, that's it for today.
Okay.
Have a great rest of your day, everyone, and we'll see you in the coming days again.
Very good. Bye-bye.